So the cardiac output is the volume of blood that is pumped by each ventricle every minute. So to calculate your cardiac output, it is your heart rate, which a heart rate is around what, 75 beats per minute, times something called your stroke volume. The stroke volume is the volume of blood pumped out by the ventricle with each contraction. Right? Normal cardiac output is about 5 liters per minute. How much blood do you have in your body? Which is how many liters? 5 liters of blood. Your heart is moving your entire blood volume every minute, okay? So that's pretty amazing. Now, at rest, let's look at changes to our cardiac output. When you are resting, your cardiac output will increase if one or both stroke volume or heart rate increases. So again, remember, let's think of the equation. Cardiac output is equal to stroke volume times heart rate. Okay? So if stroke volume or heart rate go up, then obviously your cardiac output is going to go up, right? Let's just use simple numbers. 2 times 3 is 6, right? If this number goes up and instead of 2, it's 3, 3 times 3 is 9, right? So if either or one of those numbers increases, then the cardiac output is going to go up. So normally, maximum cardiac output, so like if you are really exercising, it is 4 to 5 times higher than resting. So when your heart rate goes up, when you are exercising, let's say you go from 75 beats per minute and you are exercising, maybe you're doing like a CrossFit class, right? My softball players, maybe you're doing some like super difficult, I'm not a softball player, so I don't feel like that. Drills, training, running, I don't know. Let's say you're at 170 beats per minute. That means that your heart rate doubled or tripled, right? So that means your cardiac output is double or triple. And people who are trained athletes, their maximum cardiac output can be 7 times higher than resting. Okay? And that's because when they increase their heart rate, their heart is so efficient that it also increases their stroke volume. So the amount of blood that the heart is actually putting out is even more. So when their heart rate goes up, their stroke volume goes up. So this is, both numbers are now going up, and now the cardiac output is not just 2 or 3 times higher, it's up to 7 times higher. So this is how they are really circulating that blood and oxygen and nutrients when they need it, okay? Now we do have something called cardiac reserve. Cardiac reserve is the difference between your cardiac output when you're resting and when it's at maximum. That's your reserve. Now, there are some things that can regulate your heart rate. There are neural controls, right? I think I mentioned this earlier in the lecture, earlier this week. Anytime your mood changes, anytime your hormones change, if you are scared or happy or sad, it can change your heart rate. Those are neural controls that are affecting your heart rate. We also have chemical controls that can affect your heart rate. And then we also have physical stressors that can influence your heart rate. So what we say is anything that increases your heart rate has a positive chronotropic effect, and we call that a positive chronotropic factor. Anything that causes your heart rate to slow down would have a negative chronotropic effect. Those are negative chronotropic factors. So I'm going to walk through each one of these. Let's do neural and chemical and physical stressors. Okay, so we're gonna start with neural. A neural stressor, it is going to be coming from your autonomic nervous system. Remember, that is the division of your nervous system that controls anything that's involuntary. So things like that you don't have to think about, right? Things like your heart rate, pupil size, vasodilation, vasoconstriction. Those are all things you do not even think about that your autonomic nervous system controls, right? So because you don't think about your heart rate, it is your autonomic nervous system that can have an influence on it. Now remember, our autonomic nervous system has two subdivisions, sympathetic and parasympathetic. The sympathetic division is our fight or flight division. Here's how I remember this one. When I think of sympathetic, I say it like this. Sympathetic, like Superman, and I think fight or flight, right? So this is going to be the division where you can release things like adrenaline, epinephrine, and norepinephrine. These are going to increase your heart rate. These would be things that get released when you are panicked or scared, or like when a dog runs across the street and chases your dog, right? So these are going to cause your heart rate to go up. So this is going to increase the pacemaker, your SA node activity, which is then going to increase your heart rate. The parasympathetic division is kind of dubbed the resting and digesting. So when you are resting and digesting, your heart rate is going to drop. We say that the parasympathetic division typically will have a negative chronotropic effect on your heart rate. It's going to cause it to fall. The sympathetic division will have a positive chronotropic effect. It's going to cause your heart rate to go up. Now, when you are resting, when you are sleeping, you will exhibit something called vagal tone. Vagal tone is it's a slower than pacemaking SA node heart rate. So if you're sitting here awake right now, your heart rate's probably 70, 75 beats per minute, right? When you're sleeping at night, your heart rate's probably 60 beats per minute. You are exhibiting what's called vagal tone. Because you're sleeping, your heart rate does not have to be what it would have to be when you are awake and alert. Now, the second thing that can influence our heart rate, so remember, let's go back. I told you we're going to talk about these three things that can influence our heart rate. We did neural. Let's talk about chemical regulation. So these are hormones. Now, these are kind of linked with neural in that some hormones like epinephrine, adrenaline, norepinephrine, when these are getting released, and that's usually in response to some kind of stressor that we have, but that's also going to influence the autonomic nervous system. So hormones like epinephrine, these are going to increase your heart rate. Okay, so they have a positive chronotropic effect. Other hormones like thyroxine. So these should sound familiar. Thyroxine and triiodothyronine for short, we call them T3 and T4. These are thyroid hormones. These also can increase your heart rate. So people who have things like hyperthyroidism, when their thyroid is overactive, a lot of times their heart rate is elevated, they're thin, and they get sweaty because they're generating a lot of body heat. So those are two hormones that can raise your heart rate, okay? And then the last one I'll mention are some chemicals that can regulate your heart rate. Anytime you change ion concentrations inside heart muscle cells or surrounding heart muscle cells, that can influence the heart rate. So things like calcium, I want you to think about muscle physiology. Calcium plays a huge role in muscle physiology. Calcium is so important in our bodies. It does so many things. But if you have low calcium or high calcium, that is going to influence your heart rate. Low calcium will cause it to drop. High calcium will cause it to increase. Same thing with potassium. Potassium will influence your heart rate. Now, calcium and potassium, these both play a huge role in muscle physiology. So does sodium. So all the ions that play a role in muscle physiology, if we alter those, you're going to alter the heart rate. So high potassium or low potassium, they can alter electrical activity and can either cause the heart rate to go up or cause even things like fatal arrhythmias. They can drop the heart rate. Now, there's a few other things that I did not have on there that can influence your heart rate other than neural controls, chemical controls, and then physical, like stressors. There are some other things that can influence heart rate. Things like age. The fetus has the fastest heart rate. So a fetus typically has a heart rate of about 150 beats per minute. So I remember when I was pregnant going in and the doctor would put the little Doppler and we'd listen to the heart rate. Every time I would go in, she would listen to the heart rate of Graham. And it was around 160 beats per minute. And it sounds so fast. But fetal heart rates are high. The other thing is gender. Females typically have a higher heart rate than males, right? So 75 for females, 65 resting heart rate for males. So I remember, like I said, when I went in when I was pregnant, his heart rate was always around 160. Sometimes it was like 166. My mom is this cute little Italian lady. She's like 5 feet tall and shrinking. And she is really big on like old wives' tales. Like she knows all of them. And I remember when I came out of my first appointment, she's like, did they listen to the heart rate? And I was like, yeah, mama, they did. What was it? And I told her it was 166. She's like, you're having a girl, you're having a girl. And she said it because girls have a higher heart rate, right? So the normal fetal heart rate's around 150. One that's higher than that, she was convinced it was going to be a baby girl. I had a boy. So don't put your eggs in one basket. Don't think that those wag tales are true. Obviously, exercise can increase your heart rate and even body temperature. Your heart rate's going to go up as your body temperature goes up. And we do have some imbalances with our heart rate, tachycardia and bradycardia. Tachycardia is an abnormally fast heart rate. So it's a heart rate, resting heart rate of over 100 beats per minute. There are a lot of things that can cause this, right? Let's think back to all these things that can influence your heart rate. Okay, age, exercise, body temperature, if you're stressed. So if you're hot, body temperature can be up. If you're stressed, it can be elevated. Drugs, heart disease. Okay, so there's a lot of things. I know like when my husband goes for his physical every year, he has to sit in the room before they take his blood pressure and his pulse. And he's just like, I need a minute, I just need to breathe. Because my husband has white coat syndrome. He gets in there and he gets nervous and they're like, oh, you have high blood pressure. And he's like, no, just give me a minute. And take it again. I promise I'm fine. Because stress can elevate your heart rate. Bradycardia is a heart rate that's slower than 60 beats per minute. And this can be low temperature, drugs, parasympathetic nervous system, remember resting or digesting. But this can result, if your heart rate is really low, it can result in inadequate blood circulation, especially in people who are not athletes, people who do not have good cardiovascular health. Now, in athletes, they're like marathon runners. I had a friend who used to run marathons all the time, and his resting heart rate when he was sleeping was like 40 to 45 beats per minute. It was insanely low. And so that can happen in endurance athletes who, especially marathon runners, people who do these long distance trains, they can have a really low resting heart rate. Now, there are some other imbalances, things like congestive heart failure. Congestive heart failure is a progressive condition, which means there's really no treatment for this. It's going to continue to get worse. Cardiac output drops so low that you cannot meet the needs of your tissues. So you are not perfusing your tissues with enough oxygen and nutrients. And typically it's because the heart muscle itself is really weak. So like the ventricle, for example, is not contracting hard enough to get the blood where it needs to go. So this could be, maybe there's atherosclerosis, there's clogged arteries. So the blood can't get where it needs to go. It's encountering too much friction. Maybe somebody has persistent high blood pressure. Persistent high blood pressure causes small capillaries to get damaged and you don't perfuse your tissues very well. Multiple heart attacks can cause congestive heart failure. So multiple heart attacks, remember the heart muscle itself is not being perfused with blood. Usually there's a blockage there, so it may require like a bypass surgery. But either way, when heart muscle cells do not get oxygen and nutrients, they die and they get replaced with scar tissue. So if you've had multiple heart attacks, that scar tissue is really built up and the heart muscle is a lot weaker. Dilated cardiomyopathy. This is when the ventricles have stretched. This can be from infections or even some drugs that people take, and it causes the heart muscle to get weaker and it cannot pump that blood very well. So all of those different things can lead to congestive heart failure. Now, there are also times where one side of the heart can fail independently of the other. So remember, when we think about the heart, you know, I do that drawing. Remember, it's a double-sided pump. You have a right side and a left side. So we have our heart, right? We'll draw a line down the middle. And so remember, we have a left side and we have a right side. The left side of the heart is going to pump that oxygen-rich blood out to your body tissues. And it's going to bring that spent blood back to the right side. Okay. The right side is then going to pump the blood out to your lungs. And it's going to fill it up with oxygen and send it back to the left side so you can pump it out to your body, right? So a pulmonary and a systemic circuit. So the right or the left side can fail independently of the other. So let's look at what would happen, for example, if the left side stops functioning. So let's put an arrow, draw an X to the left side. The right side's still working. So what's going to happen is the right side's going to keep working and it's going to keep pumping blood out to the lungs. But if the left side's not working, then what's going to happen is it's not going to pump out to the tissues and the blood is going to back up in the lungs, right? So the right side's going to work, it's going to pump out to the lungs, left side's not really going to feed the tissues, right? The lungs are going to end up filling up with fluid. This is called pulmonary congestion, right? Because the right side's still working, it's still pumping out to the lungs. The left side's not really taking it and sending it to the body. So the lungs just keep filling up. Pulmonary congestion. It ends up making it very difficult to breathe. It's almost like when people have pulmonary congestion, it's almost like they're drowning, right? It's hard for their lungs to fill up with oxygen because they have so much fluid on the lungs. It's really blood. The opposite is called peripheral congestion. So let's go back to this whiteboard. Okay, so let's say the right side stops functioning and the left side keeps on working. Okay, left side's working, left side's pumping out to the tissues, but the right side isn't really taking it back and it's not taking it to the lungs. And that means that the fluid is going to hang out in the tissues. Okay? It's not really going to make it back to the right side.
When they say people have fluid and they give them the Lasix pills, if that's what
Absolutely. So this is going to cause excess fluid buildup in the tissues. because it's not being taken back by the right side. It's not going out to the lungs. So in this case, we call this peripheral congestion. So blood pools in the organs, you get a lot of swelling. And so like you just said, right, it's going to cause, a lot of times they'll be given Lasix to help just kind of cut down on the extra fluid that might be in their tissues. Now, you may want to star this. You may want to draw, make sure you can draw that drawing. I'm going to ask you a question about this. It'll probably be a bonus question that I asked you about this, but people usually get this one wrong. I think for me to remember, I have to write it down. I have to see my drawing. I have to put an X to the side and kind of look at what's happening and what's not happening. Otherwise, you say the opposite of what is correct, okay? Because you hear pulmonary congestion and you think, oh, okay, well, the right side sends out to the lungs, so that's right-sided failure. But it's not. It's left-sided failure, okay? Now, if either side fails, it's going to weaken the other side because the other side is going to have to work harder to overcompensate. In cardiac muscle, it's not like skeletal muscle. The harder it works, it doesn't get stronger, it actually gets flabbier. So both of these conditions, they are long-term conditions. There's really no cure for these. Symptoms can be alleviated by removing fluid, treating with Lasix, decreasing blood pressure, giving drugs like digitalis so the heart works harder. There's really no treatment, okay? Nothing to cure this. Now, we can diagnose heart disorders by either doing a heart cath. With a heart cath, they're actually going to introduce the catheter up. Usually they'll use a vessel in the leg, and they'll introduce that catheter up through the vessel and work it into the heart. Or they can do an echocardiogram, and this is basically an ultrasound of the heart to look at all the chambers. So you can see over here, this is a heart cath, and in this one, they put it up in one of the vessels up in the thoracic region to take a look. And this is an echocardiogram. This is an ultrasound. So if they suspect something is wrong, they may do one of those diagnostic tests. Now, for the embryonic heart, it typically will start as 2 tubes. You can see here. Okay, so there are 2 tubes. Those tubes will fuse together. And by day 22, the heart will start pumping. So it's so early. Usually when you are pregnant, when you call your doctor, they will have you come in around week 6 or 7, and they can, with an ultrasound, see a fetal heartbeat. Okay. The heart will continue to elongate, and it'll start to bend and twist. And then by day 35, the bending is complete, and that heart is pretty much what it's going to look like. What most people don't realize, we'll talk about this more towards the end of the semester. What most people don't realize is that when I say 6 weeks pregnant, you are considered at that point as 2 weeks past your missed period. Okay, so they count your weeks being pregnant from the day of your last period. Okay, so when you're 6 weeks pregnant, you've only missed your period by 2 weeks. It's not that far. And so all of the development in an embryo happens so early in those first couple of weeks. So this is why it's so important, if you know you are trying to have a baby, to take prenatal vitamins, don't drink, don't smoke, because during that embryonic stage, it is so susceptible to any kind of environmental stressors or any kind of drugs or anything that you are doing to your own body, okay? Because everything is forming. Heart is forming, the nervous system is forming, every organ system. Now, I mentioned this earlier. The fetal heart structure is a little bit different than the adult heart structure because the path of blood through the fetal heart is a little different because a fetus is not breathing oxygen, right? It is in utero, it is an amniotic fluid, so it's not breathing oxygen yet. So we actually find holes in the heart to bypass the lungs. One hole is called the foramen ovale. It connects the 2 atria together. And then we also have another one called the ductus arteriosus, and this connects the pulmonary artery to the aorta. So let's look at this picture. This shows you both of these. So we can see here, that hole, they're trying to show you the hole right here. That's the foramen ovale. So that one is connecting the right and left atrium together. So when blood comes in, it's already oxygenated in a fetus, right? And so we don't have to send it all to the right ventricle and out to the lungs. Instead, we can send some of it straight over here to go out to the body. The other hole is here. And this is called the ductus arteriosus. So again, we don't need to send all this blood out to the lungs. So here's a shunt, and then up here is a shunt at the ductus arteriosus. So blood that does make it into the right ventricle and out the pulmonary artery, some of it gets shunted right into the aorta. Okay? So what we're doing in the fetal heart, there are these two bypasses that are just helping the blood bypass the lungs. Okay, one would be here to get it over into this left side, and the other one is here to get it up into the aorta. Now, there are some congenital heart defects, and a lot of these have to do with those holes not closing over. They can be treated with surgery. So the term patent means open. So an open foramen ovale, this is when that hole between the right and left atrium doesn't close. A patent ductus arteriosus, let's go back. That would be here. Okay, that's where the ductus arteriosus between the pulmonary artery and aorta doesn't close. There's also two other ones, and I'll show you pictures of these. Okay, so here's a patent foramen ovale that stays open, and there's mixing of oxygenated and deoxygenated blood. This is a patent ductus arteriosus at the bottom left. Okay, again, mixing of oxygenated and deoxygenated blood after the baby starts breathing. There's another one called coarctation of the aorta, and you can see that right here. It's where the aorta gets really skinny. It almost is constricted. So it's really going to limit blood flow through the systemic circuit. That requires surgery. And then another one is called the tetralogy of Fallot. This is a whole bunch of things. This is, a lot of times it's the foramen ovale is still open, but also you can see here, you can see that the septum, the interventricular septum is not fully formed. So the right and left ventricle are completely open to each other. You can also see that the pulmonary artery is stenotic, so it's really small. It can't really get the blood out to the lungs. Typically, this requires multiple surgeries to fix these issues. A couple other things I'll mention are just some changes that affect the heart. As you age, your valves become a little bit more stiff, so they don't open and close as well. And this is going to cause heart murmurs. So that sloshing sound, blood can move backwards. There's a decline in your cardiac reserve. So that means that the difference between your resting and your maximum cardiac output has dropped. So your maximum heart rate has declined a little bit. You are not as able to respond to certain stressors. When you exercise, you probably shouldn't let your heart rate get super high as you age. Cardiac muscle will start to go through fibrosis. So the cells will die, but they're not replaced with cardiac cells, they're replaced with scar tissue. And then atherosclerosis is hardening and like a plaque buildup in the arteries. This is truly caused by inactivity. It's caused by poor eating, a diet that's high in saturated fats. So it is so important that you watch all of that as you age. Smoking, stress, all of those things. It used to be thought that atherosclerosis was something that we only saw in older people. Not anymore. We see it in young teenagers because they're eating McDonald's and Cheetos and playing video games all day. You know, like I remember when I grew up in the 80s, my mom was like, it's 8 o'clock, go find some friends. I'll ring the bell at dinner time. Like it was, like, we weren't allowed in the house during the summer. It was like, go outside and play, find friends to play with. And we would play kickball and build forts and run around, do all kinds of stuff. And now kids like have their phones. And this is what they do all day. So people are so much more sedentary than they used to be. So we see this condition in younger and younger kids. It's kind of sad.